Okay, so we've got a few more questions from the floor. We're going to go for 2, and then I'll check back in with the candidates. So this question is, budget cuts to DFO of $86 million, of which $50 million is in Atlantic Canada, will cause the Fisheries and Oceans Canada to cut programs, close facilities, and lay off staff. The death knell to wild Atlantic salmon. So the question for the candidates is, will your party roll back corporate tax cuts and use the $24 billion over the next 4 years for healthcare, environment, social services, seniors, and government services, including proper funding for Fisheries and Oceans Canada, protect wild Atlantic salmon? So we're going to go to Kris first, please.
Ooh, that's a big question. It covers a lot of things. If I can remember it correctly, yes, the Green Party of Canada does support rolling back of corporate tax cuts and reusing that money for things that I think Canadians feel is worthwhile. Things that reward everyday people instead of rewarding fat cats who will squirrel that money away. I recently read a perfect description of trickle-down economics, which is what the Conservatives are really talking about with these corporate tax cuts, by John Galbraith, and said that if you feed the horse enough grain, the sparrows will find enough to eat in the manure eventually. And that's really what we're talking about here. The Green Party will not stop there. We want to use that money to help bring down the income tax levels of all Canadians and to put that money into small businesses who are the real job creators in this country. I think that's something that we can all relate to here on the South Shore. Those are the employers, those are the people who are bringing real wealth and real money into small communities like this one, and it's something that the Green Party would very much support. Yes, thank you.
Okay, next we have Gordon Earle.
The NDP has always been in favor of cutting back on the tax breaks to the big corporations, which are already profitable. These corporations quite often are making profits, and they'll come in sometimes on the promise of jobs. They get set up, and people rely on those jobs, and all of a sudden they're moving their headquarters elsewhere, or they're laying people off. And yet they've accepted a tax break which they don't really need. Now, we feel that that money can take care of so many of the problems in our society, the affordable housing, the healthcare system, education, and so forth. And I think it comes down to putting our values in the right places and valuing people and what's important to them. We were at the school, Sir John A. Macdonald School this morning, and at the end of the program, they gave us a little gift to show their appreciation for us being there. And when I read the card, it had a real meaningful notation on it. It says, one's life has value so long as one attributes value to the life of others. And I think this should be a guide when we're formulating policy. We should be looking at people and the value that their lives have, and not just thinking about the bottom line being profit, dollars and cents. It's important that we value people as people, do what we can to try to help them. And I think cutting back on the corporate taxes and putting that money, spreading out through our society in a way that's going to help people is very important. We did this a while back, the NDP, when we kind of had a balance of power there, and we forced the Liberal government to cut back on taxes, and that money was put toward education and other things which were a benefit to people. So certainly we would continue with that line of approach and try to make sure that we don't have a situation where all of the wealth is included in the hands of a few and the many go without. Thank you.
And Derek Wells.
Yes, it's very clear from our platform that we would roll back the corporate tax cut and put it back up to 18% from the number that is now 16.5%. That would still make us very competitive worldwide. You have to have a competitive tax rate. You know, these corporations, even though they make money, we do want our banks to be stable and be profitable. So we don't get ahead of ourselves here. That's what got us through the recession. But at the same time, we can't be giving corporate tax cuts with borrowed money. And that's what we're doing now. When Paul Martin did the corporate tax cut initially, it was when we were in a surplus. And that's when you give the corporate tax cuts, when you're in a surplus, not borrowing money that you could be using for health care and early childhood learning, the child care plan. That's not the time. We have a very competitive tax rate at 18%. Didn't need to roll it to decrease it to 16.5. And we, in fact, would put it back to 18%. The theory is that those tax cuts the companies would take that money and create jobs. And we all want jobs, we all need jobs. But in reality, there's only one economist in the country that's saying that's what would happen with this money. And that's the one Stephen Harper's quoting. Every other economist, every other expert on the field is saying that money is being built up as cash reserves in these big companies. It is not being used to buy equipment to create jobs. And if it were, you could perhaps, argue for it, but it's not happening that way. You talk about DFO cuts, you talk about ACOA cuts, let's talk about the Yarmouth Ferry cut. I mean, that is a cut that damaged this economy to the tune of about $25 million for a saving of $3 million. That is the type of cut that damages this community, that people have to stand up and say something about it, because it has damaged this economy. I have to talk to people from one end of the riding to the other. That cut of the Yarmouth Ferry has been devastating to our businesses. Thank you.
So we're just going to do one more question, okay? And so the last question is about healthcare. The current healthcare system is dysfunctional. What will your party do to ensure that after 2014, Canadians will have an improved, portable, universal, accessible healthcare system? Okay? And so we are going to start with Derek Wells.
I wouldn't call it dysfunctional. So I don't agree with that. My wife's in the room; she's a doctor, so I don't want to go there. She went to work at 6 o'clock this morning and got home 6 o'clock tonight just to come here. So we got hardworking doctors and are giving some pretty good care. But we have to defend healthcare. We have to enhance healthcare, and we have to make sure that it's properly funded. Healthcare, to answer all the ills and what you do in healthcare in 2 minutes is not possible. You know that. But there are some things that we need to reform, but we have to start off by making a commitment to the Canada Health Act. We have to make that commitment to universal, free, quality, timely healthcare. And that's what the Liberal Party has done. But we have to improve things in it. We have to improve home care services. We have to improve drug coverage. We have to deal with a Canadian brain health strategy. Part of the Liberal platform is put $100 million over the first 2 years of a Liberal government for research into treatment and cures for Alzheimer's and other forms of dementia. That is a critical issue that is not nearly addressed enough. We have to put more money in mental health. I mean, these are areas of our healthcare system that need investments, that need some thought, and we need thoughtful people to talk about it. We are suggesting a health promotion and Canada's first national food policy. We have to eat healthier. We have an obesity problem in this country. We have additives in foods, salt and things of that nature that is just not acceptable. It's unhealthy. And we have to deal with those sorts of things. We have to live healthier. It's not only about health care, it's about health. And let's not mix the two up sometimes, because they are different issues. We have to be healthier, and then when we need it, we have to have good health care. Thank you.
Next we have Kris MacLellan.
Health promotion is about more than just healthcare or health education. It is about recognizing that the profound health impacts of determinants of health outside of the formal healthcare system, and working with many stakeholders to reduce, eliminate, or overcome those factors that harm health or act as barriers to health enhancement, and to promote those factors and that enhance the health and well-being and quality of life for all Canadians. It is imperative that the federal government works in cooperation with the provinces, territories, and Indigenous governments to ensure stable and increased funding for preventative health programs. The Green Party of Canada will act to diminish the use of chemicals known to have a significant risk of human cancer, immunosuppression, and endocrine disruption. We will set up a national universal pharmacare program, a Crown corporation to act as a bulk buyer and drug purchasing agency, and to make new drug patent protection times shorter. Pharmaceuticals now account for 20% of all of Canadian healthcare costs. The Green Party will work to help allocate funds to begin training more doctors and nurses to ensure that every Canadian has access to a family physician and team-based care. We will work to develop a more cost-effective post-op recovery care, community-based to reduce hospital costs and reduce wait times. We will commit to national mandates for wait times in this country that are right now going ignored. And we will work to ensure long-term care facilities are available so that much-needed hospital beds are not misused for those such as seniors, those with dementia or Alzheimer's needing long-term residential care. We need to reduce the bed-to-bureaucrat ratio in this country. We need more beds and fewer managers. Thank you.
And finally, Gordon Earle.
Well, thank you very much. We would strengthen healthcare with a new 10-year accord. We will negotiate a new 10-year health accord with the provinces and territories in 2014. The accord will guarantee a strong, continued federal contribution, including the 6% escalator to Canada's public health care system, in return for a clear, monitored, and enforced commitment to respect the principles of the Canada Health Act and to the integrity and modernization of health care. We will work with provincial and territorial partners to promote a clear commitment to a single payer system, make progress on primary care, take appropriate steps to replace fee-for-service delivery, take steps to reduce the cost of prescription medications for Canadians, employers and governments, extend coverage to out-of-hospital services like home care and long-term care. We would invest in more family doctors and nurses. We will work with the provinces and territories to address the shortage of doctors, nurses, and other healthcare professionals by training 1,200 new doctors over the next 10 years, adding 6,000 new training spaces for nurses over 6 years, and substantially increasing the number of training spaces for other health professionals. In collaboration with the provinces and territories, we establish programs aimed at recruiting and supporting low-income, rural and Aboriginal medical students. We would expand care for seniors. We would make medicine more affordable with a national pharmacare program, using the bargaining power in pharmaceutical purchases. And we would keep kids healthy and safe in sports. We would implement a children's nutrition initiative to support and expand provincial and local programs that provide healthy meals to school children. And we will enact the NDP's National Strategy for Serious Injury Reduction in Amateur Sport Act. Because we know that a lot of the problems with, is that red card. Thank you very much.